second wave of COVID-19 hit India hard. But case numbers look like they're falling. Restrictions are easing. So is India ready? Shops, businesses and public transport are opening in Delhi. People in Mumbai can catch a movie at the cinema. Still, the country's vaccination drive is sluggish and testing isn't widespread. Experts warn case numbers and deaths are being underreported. They say it's too soon to lift restrictions. Welcome, I'm Ben Fazulin. After almost 2 months lockdown in Delhi, the construction sector is one of the first to reopen. It relies largely on migrant labourers who've been returning to the big city from their villages in the hope of finding work. DW's Manira Chowdhury sent us this report.
Daily wage labourers gather here every morning to find work. 32-year-old Yogesh Kohli is one of them. He is an unskilled migrant labourer who has been working in the informal sector in the capital for almost 6 years. But times are tough for him. He was left without any work when Delhi went into lockdown after the city was hit by the second wave of COVID-19.
We're barely getting any work. There is so much unemployment. Many other laborers have also come back from their villages. They wait here for a job every day, but there just isn't enough work.
Yogesh says he finds casual work only 1 or 2 days a week, hardly enough to make a living. Economist Prabhakar Singh says the problem is much bigger. He says that many migrant workers are choosing not to come back at all and are dropping out of the workforce because they see few opportunities of finding employment. And he thinks any recovery will take time.
It's not the virus cycle which determines the economic cycle. It is basically the larger effect of the first wave is still lingering on, and it will compound with this second surge, and it will possibly get into a bigger effect, or it will take a longer time for the economy for the labor market for the employment rates to come to the nominal or normal terms.
Yogesh, the unskilled worker, remembers how last year millions were left jobless during the national lockdown. Some of them never found work again. He fears that the same may happen to him.
I'm thinking that if I don't get work soon, I'll go back to my village. And it looks like I might have to. There seems to be no work right now.
It was another day with no job for Yogesh. He will be back again at the same spot tomorrow morning waiting for work. But he doesn't know how much longer he can hold out.
So here we are again talking about lives and livelihoods, whether or not to open or reopen, with Rajdeep Dasgupta, chairperson of the Centre of Social Medicine and Community Health at JNU in Delhi. Last time we spoke a couple of months ago, the situation was dire. Thousands were dying every day. Hospitals were close to collapse. They'd run out of oxygen. How are things now?
Hello, Ben. Good evening from New Delhi. Last time we spoke, yes, it was dire straits. This time, of course, people have heaved a sigh of relief, notwithstanding the losses each family has gone through. Things certainly are a lot better now, particularly in most of the high incidence states. Different sectors of the economy, as you said, are opening up. And the challenge before politicians as well as administrators is how to balance the needs of lives and livelihoods. I think the key challenge at this point is maintaining the COVID preparedness, but also making workplaces safer from the COVID point of view.
You sound quite optimistic in your judgment of the situation, but the death toll was only spiking again just a few days ago. I mean, we had the highest numbers reported so far just last week.
Well, the death toll has certainly been high. As I said, it's been very painful for almost each and every family. Last week, the death figures are to be understood in the context that several states actually reviewed and audited their death figures, sometimes under directions from their respective high courts. And therefore, some of these corrections have actually taken place. It's not that the absolute number of deaths in the preceding week has been that high. And yes, therefore, the deaths that we have ended up with are certainly higher than it seemed. And some more states are going through this correction or audit process, and the tally could actually be a little higher than even what it seems now.
Well, the health department in Bihar, one of India's poorest states, revised its total COVID-related death toll from some 5,500 to over 9,500 on Wednesday last week. What's going on? Is this down to underreporting in some places?
There is certainly an element of underreporting. This is not necessarily to indicate that this has been deliberate, but it's part of the system coping up. There is also the WHO advisory issued last year, as early as April 2020, as to what counts as a COVID death. And it seems that the clarity of that document, of those definitions, and certainly some of the subtexts of those definitions perhaps didn't really tally with what health departments were actually doing. And therefore, as in the case of Bihar, the High Court of Bihar actually asked for this audit or review process. And this change or the uptick in the figures is really a culmination of that process.
Rajib, what about this highly infectious Delta variant, if I can butt in there?
Well, the Delta variant, which is actually the sublineage of B6171, was identified in India earlier this year in the southeastern districts of the very large state of Maharashtra. It's now subsequently swept through several large states, including Delhi. Delhi actually has been affected both by the Alpha variant as well as by the Delta variant. And therefore, a lot of what we witnessed in the second surge in India does owe a lot to the damage caused by the Delta variant. And therefore, India has now gone through this variant largely. We have gained in that experience. States have coped with this surge in various manners. And we certainly see the Delta variant-led surge subsiding in most states, including Delhi, Mumbai, as the earlier report indicated. And therefore life is certainly limping back to normalcy.
You mentioned before that businesses are not giving enough attention to preventing the spread of COVID-19 in the workplaces. The economy reopens. Is India on top of this? Is the country taking the right steps?
I believe making workplaces safer, and by this workplace I do not just mean office spaces, but in fact all walks of economy where people are working in indoor environments. That's something which we really need to focus a lot more beyond the usual platitudes of maintaining distance, etc. Because in real life situations, workplaces, not just in India, this is true of many countries in the world, aside from those who actually have the option of working from home, those who actually need to be physical in workspaces do face a lot of risk. Anecdotally, these are the people who have suffered much of the brunt in the second wave, and therefore we really need to do a lot more on making workplaces safer, just going beyond washing hands and so on, because the structural issues of the buildings, the rooms, the ventilation, the air conditioning systems, wherever they are available, these certainly need a lot more attention and details.
Okay, you heard it from Rajib Dasgupta from the Centre of Social Medicine and Community Health. Thank you.
Thank you, Ben.
Well, we talked about it before. For several weeks, it was referred to as the Indian variant. I know if I were Indian, I'd take offence. It also has a long, complicated lineage category, but now it's called Delta. More on that with Derek Williams and this viewer question.
Is the B16172 variant more deadly as well as more contagious?
This variant of concern, which has been designated Delta under a new naming system recommended by the WHO, it was first identified several months ago in India, and it has subsequently been found in many other parts of the world. although final proof is still missing, there's significant evidence that B16172, or Delta, is a lot more transmissible than the original version of the virus, and even more contagious than the Alpha variant that hit some countries hard last winter, in particular Britain. There, Delta is now causing fresh concern after the country planned to leave lockdowns behind on June 21st. Delta is estimated to be causing around 9 in 10 cases in a new surge in the UK. We're still flying blind in many places when it comes to tracking the spread of specific variants and tying them, for instance, to hospitalizations. That makes it hard to currently say with any certainty whether the Delta variant causes more severe disease. But the evidence is mounting that it possibly does. Britain's responsible agency said that its early data indicated that people who got the Delta variant were more than 2.5 times more likely to end up hospitalized than those who had contracted the Alpha variant. And Chinese officials, according to the New York Times, have also said more patients in a new outbreak linked to the Delta variant there are showing up at hospitals more severely or critically ill. So evidence would appear to be mounting that the Delta variant is indeed more dangerous, especially to people who haven't received at least one dose of vaccine. But healthcare authorities and many scientists don't think the evidence is robust enough yet to make an unequivocal case.